Good afternoon, Facebook followers. My name is Tom Lowy. I'm a reporter and columnist from the Galesburg Register-Mail, and I am finally on the air after some technical difficulties because I'm an idiot. Brooke Thompson, you're from the Community Health Center.
Yeah, I am.
And we are sitting in Moontowers, and we're going to talk about a diabetes self-management program.
Correct.
So let's talk about first what that means. What is a diabetes self-management program? Like?
Our diabetes self-management program is a 6-week program. We meet once a week for about 2 hours. And we talk about how to manage your diabetes and or a family member that has diabetes. This incorporates, healthy eating, meal planning, how to just deal with the disease in itself, depression, problem solving, how to communicate with your providers about your disease as well.
Diabetes diagnosis, it didn't occur to me until we were doing this pre-interview, but it's a life-changing or life-altering and therefore behavior-altering and emotional.
Correct.
And so I didn't think about things about like depression as being a component of being diagnosed with diabetes. It's interesting that it's an all-encompassing program that you have.
Yeah, a lot of people have the questions, why me? Or when it's holiday time and your brother's over there eating all the sugary, nice sweets, and you have to think that I can only have one, or I have to eat this in moderation. It can be depressing. And also, sometimes it can be life-changing in a way that it takes a lot of time to figure out how to get your numbers in the right areas so that you aren't having complications related to diabetes.
Right. And let's explain to people, I think maybe for people who don't know, what is diabetes? I know there are different types, and so this program addresses both types.
Yes,
I assume.
It does.
Okay.
It does. And it addresses like where your blood sugar should be and what you're aiming for, and goals, and how to set goals, and how to achieve goals as well with your provider and you. Your provider is your coach, and you are the student. And the best way to deal with managing your diabetes is to follow instruction.
Okay. So we're in Moontowers, and you folks have chosen Moontowers kind of based on some geographic profiling that you did of clients. Is that correct?
Correct, yeah.
Okay, and so you're going to meet here starting today, correct?
No, this is our third class.
Oh, okay. I'm sorry.
Yes.
I'm sorry.
This is our third class out of 6. The weather has altered that as well.
Right. Okay. So you're going to do 6 classes here.
Mm-hmm.
Everyone's welcome, right?
Anyone's welcome.
So it's not just for Moontower residents.
No. So there is some rules and regulations along with the class. So you can only miss 2 classes. So if you aren't here for the first class, but you make it to the second class, then you're in the class.
Okay, gotcha.
But if you miss the first 2 classes, which are the structure of the class, you have to wait till the next class. But we do plan on having other classes at other places.
Yeah, this is kind of a pilot program, correct?
Yeah, in a way.
It's
our first one.
It's for existing people who use the community health center. But then It's also a kind of outreach. Is that correct?
Correct. So anybody in the community can really come. And you don't have to have diabetes.
Right, exactly. You can be a family member of somebody.
Correct, yeah.
Which is really interesting. So you targeted patients and kind of went from there. So it's kind of an outward growing circle that you've got going.
Yeah.
How have things gone so far? First 2 classes now, obviously weather interruption. So you got to think back probably a little bit.
I was kind of nervous the first couple classes, or the first class especially. But it's went really well. And I feel like our patients are grasping the concept and are understanding what we're trying to get across to them. That you don't have to go on a diet. Everything's just in moderation. Lifestyle. Right. And then we have a goal at every class, and then we ask them how they've achieved their goals at the end of every class.
Right, gotcha.
So every class we have a new goal. Whether it is, I'm going to walk around the block 2 times a week, and I think my confidence level is a 0 out of 10. Or if they think that they are going to need to modify their goals each week, then that's what we do.
Okay. To recap for Facebook viewers, we're joined by Brooke Thompson, and she's from the Community Health Clinic. And they're doing an outreach program, a pilot program. It's a diabetes self-management program. And started up here, you're in your 3rd class here at Moontowers, correct? And so I know this is going to be repetitive, but we've got people just joining us. Tell us again a little bit about what this program is and who it's aimed at.
It's aimed at individuals that have diabetes, or individuals that take care of somebody with diabetes, or
Right.
even an individual that just would like to know more information about diabetes.
Right. And so tell us about some of what they learn during the program.
Healthy eating, meal planning, how to communicate with your providers, what good numbers are with blood sugars and A1Cs, good activities, or
Right.
activities that lower or raise your blood sugars as well.
And one of the things that we touched on earlier is you do address some of the behavioral health concerns
Yeah.
like depression and feelings, of life change.
Yeah.
All right. And you think it's gone well so far?
Everything's went pretty well, I feel like.
Okay.
We've had pretty good attendance. Like I said, the weather's gotten in the way a few times, but our
Yeah.
attendance has actually was better than we thought it was going to be. So
Great.
we're happy
Great.
with it.
If people want to find out more about future programs, they contact the Community Health Center, and we'll put that phone number below.
Ask for specific Carol Rogers and or Brooke Thompson, and 344-2225 is our number.
344-2225, and I'm going to post that in the comment section. That'll go right up top. I'll put Carol Rogers' name in there. I know her. And I got a chance to meet you. Thanks for joining me today. I really appreciate your time. And folks, we've been learning a little bit more about the Diabetes Self-Management Program. It's taking place right now at Moontower, and it's kind of a pilot program that they're just starting out, teaching people various aspects of living with diabetes, living successfully. And so hopefully you guys will be able to continue this program in other locations throughout the city.
We will have more information about our next class. We are meeting upon it actually tomorrow to try and figure out where and when we're going to do our next class.
Okay. Brooke Thompson, how'd it go?
Good.
All right. Well, you did great.
Thanks.
Thanks a lot. Folks, thanks for joining us.